everyone. Today I'm going to talk about motivational interviewing in the context of a client that I most recently had. Um, this person is a 55-year-old woman who suffers from agoraphobia and severe social anxiety and depression, possible borderline personality disorder, though that diagnosis has yet to be confirmed. Um, So I've been seeing this client for over, I want to say, about 13 weeks now. We engage in weekly phone conversations and kind of gauging an intervention so as to get her out of the house. And so what the client and I have been able to do, which are some important interviewing methods, are to build rapport. Hello, how are you? How are you doing today? One of the most important factors of motivational interviewing is to make the client feel like a real person and that this isn't some clinical type of process that's going on. And so we build rapport. So with this client specifically, I found out that she has one daughter, and she was in previously an abusive relationship. And so when you get to know the person, you are able to kind of build a rapport that gets you to the deeper level of the issues and kind of disarm them. So getting to the root of her behavior in this motivational intervention, the client did not want to go outside, hadn't held a job in about 2 or 3 years. And so the key goal here was to get the client to engage more socially and also physically with her environment by going outside of the house and kind of using her support system to alleviate the symptoms of her mental illness. So what we did was we went back over a timeline of her history in terms of all the things that she had survived. And the technique was to use her strengths of overcoming cancer and surviving an abusive relationship to motivate her to go out and possibly seek employment or to reach out to friends in her support system that she had previously lost touch with. So some of the challenges invoking change in the client was to get her to stick to a plan. We would agree on a goal for the week, and we would be sometimes dead set, and we would communicate sometimes on separate occasions to talk about some research on the importance of engaging with your mental health and taking positive steps, or the importance of, becoming a peer or something like that. And it seemed that the plan was all well and good until the client actually got to performing the action, and that's where she felt the most stunted and kind of gave into self-doubt. Success in directing change has been the frequency of our communications. The client is more apt to push herself to engage socially in these sessions, and although that seems like sort of a beginner type of level to be at, before the client and I had engaged, she was not taking phone calls whatsoever, had many numbers on her block list, and so to keep her as a consistent client has been the greatest success in directing change towards her her self-confidence and belief in herself. So the takeaways from this activity of motivational interviewing with the client were to try to be more creative with the interventions. For example, in the motivational interviewing technique, One of the key things to do is to kind of get the client to arrive at their own stage of change. For example, at the beginning of our conversations, the woman in question was at the pre-contemplative stage, and now she is more headed towards the contemplative stage, where she's ready to maybe start to take action. But we're not quite there yet. And so what you want to do when you get your client to the stage of change is to have them arrive at the conclusion themselves and kind of parrot some of the strengths and weaknesses that you might have gone over in assessing whether the behavior is a positive or negative coping mechanism.